Almost everything I do reflects the commitment that I have personally to do the most excellent job that I possibly can. I spend hours reading orthopedic literature. I go to meetings, I have friends all over the United States and in fact all over the world that I talk to, and I have the opportunity to learn from them. I also learn from my patients. Every time I do a surgical procedure, I'm always asking, how could I have done that better? What could we do differently here that will make this easier for the person and make it work better for ourselves in the field of orthopedic surgery? I've written papers, for example, about things that I've done. I've written papers that have described a new type of tendon damage that no one else had described previously, just from something that I learned from a patient and I observed in the operating room. And I think that contribution has probably helped thousands of people all over the world.
The nurse practitioner said that he was a perfectionist. And I said, how do you know that? And he said, I have scrubbed with him. And he says, I have watched him perform. He said he was a stickler on perfection. He said, if it's done right, he said, you generally would get good results. Well, that impressed me. But then when I sat down and talked to him, I could see just by talking to him, this man knows what he's doing. He isn't going to monkey around and give you a bunch of, chatter. He's going to tell you like it is. And during my life, I've always found that the best people I've ever known will come out right up front and tell you like it is. And so I said, okay, let's schedule it. And so we did, and like I said, I did it in the spring. They had me out of bed the very next morning after surgery and had me on a walker. And they walked me down the hall and then back to the bed. The second day, I got up and they helped me out of bed, got on my walker, went into the bathroom, and I shaved my face. For the first time, I don't know, a year and a half, almost 2 years, that I could stand there without any pain. And as a result, from that point on, it went up. I got better. They got off any pain medicines, and I still didn't have any pain. They recommended 2 weeks therapy and sent a team out. When I say a team, one gentleman whom I had seen twice, having had 2 hip replacements. And then I spent 6 weeks in his therapeutic facility back here. And I want to tell you, the girls he hires back there are pros. They know what they're doing, and they did a super job for me.